Hey guys, Dr. Khan here at Forever Smile in Garden City. I want to go over a couple things with you guys. What we do here. As you'll see, we're here in the lab. We're in the process of setting up. What we do here is help patients with basically terminal dentition. We see a lot of patients day to day where they come in with several missing teeth, several broken teeth, or teeth that are just not restorable. You're not able to save them and they've been in bad conditions. They have not seen their dentist in a very long time. The goal is for us to be able to provide same-day teeth for our patient. When we do these same-day teeth, we do temporary same-day teeth. We remove the decayed and broken teeth and we clean out any of the infection sites for the patients and go ahead and place 4 to 6 beautiful implants in their mouth and start the process of healing. Because of our lab, because of the technology that we have, we're able to provide them same-day temporary teeth so they can leave here. We follow them throughout their journey of the healing process during the 3 to 4 months of healing, after which we take them from those beautiful temporary teeth to even better final set of teeth which they're able to use and chew and function like they were never able to before when they started losing their teeth. And when we go through the process, we figure out each case is different, each case is custom. We want to figure out, we have our in-house lab that allows us to design and do things. A lot of people do surgery first and then try to figure out how the prosthetic needs to work. We do it the opposite way. We figure out where the teeth need to go in the mouth first and then build everything from there, because prosthetics is the most important part when it comes to all these surgeries. If you do not get teeth, occlusion, and prosthetics right where it needs to be, anything we do, we're setting it up for potential failure. That's why we do some temporaries. When patients come in, we use that time while they're healing, while the implants are integrated into the bone, to dial in their bite where things need to be. And I think that's what differs us from a lot of places.